Hi folks, today is Wednesday, August 18th, and so a little bit of good news to start. I got a new microphone. I've been getting some feedback from folks at the end of our pandemic Lollapalooza of videos at the end of the winter that the microphone wasn't working that well. So I think this one works better. So you can hear me, which is great, and a few things to share today. Number one, last night we sent out a memo to our staff teams to let them know that as of October 15th, we will require the vaccine, everyone to be fully vaccinated as a condition of employment. We obviously will allow for medical or religious exceptions, but I think this is the right thing to do. I'm sure this is the right thing to do. We have, at this point, almost 90% of our staff vaccinated already. But there are still some folks who have not gone through the process, and we need them to. What I anticipate is this may be, in the short term, add a little bit more of a challenge for us in some staffing. But we need to do this with the Delta variant spreading so easily. It's just a way to protect our staff, have them be protected, protect their families, and protect our community here and their coworkers here. So that's happening, and October 15th will be the date by which all staff has to be fully vaccinated. Second thing is we've heard questions about booster shots, and this week the government authorized third vaccination doses for certain people who are severely immunocompromised. It's a short list of people who fall into that category. If you think you do or you hope you do, call your nurse practitioner. They will explain to you whether you do or not. But we're also starting to hear more talk about a potential for all people getting a booster shot at about 8 months or so post second shot. And for us, that would fall into about the October timeframe. So we're on that. We're paying attention. We're talking with leading age. And if that does become a possibility, you can rest assured we will do everything we can to have vaccine clinics here on site like we did over the winter. Masks, can't say this enough. We really strongly encourage you, as much as people say, I'm never going to wear a mask again. I do. When you're out in public with people that you don't know their vaccination status, just protect yourself. We've had some breakthrough cases for folks who are living in our independent living units, and why take the risk, right? So when you're with people you don't know, just wear your mask. Last thing, we will, because we are going to require all of our staff to be vaccinated by October 15th, we will also require all visitors to be vaccinated by October 15th. So I know that will pose a challenge for some people. If you have grandkids who are under the age of 12, that's not yet authorized for them. But what I would ask you to do is let your visitors know. First of all, tell your kids they should be vaccinated anyway, if they're coming to visit you and your friends. But all visitors will need to be vaccinated, and that includes if you have home health aide or you have someone coming to do work in your apartment. If they have to go through our AccuShield to check in, they need to be vaccinated. It's just the right thing to do. We have cases in New Hampshire are rising, cases in the country are rising, and this is what we all need to do to keep ourselves, our families, and our communities safe. So with that, I will sign off for now and just say stay healthy, my friends. But hey, one more thing, and I'll be quick. But I just want to tell you a story. I went out to dinner last night because my daughter, who just graduated college, got her first career job, and I couldn't be more excited. Went off my payroll. But we took her out to dinner, and we were sitting outside in a restaurant, and the people next to us, the service was slow, very slow. Like it took about 3 hours to eat our dinner. But the people next to us pretty much lost their patience on our server. And I thought to myself, and we actually talked to the person, this is everywhere. There is just an absolute lack of people who want to work right now. And I know that we're not exactly what you anticipated in terms of service. And we can be better in dining, in housekeeping, in our driving, in just our communication, in pretty much everything we do. And what I want to assure you is we're working at that every day. We're working on it in two ways. One, to recruit all of the team members that we need to be able to do this. And two, we're working at finding better and different ways to be more efficient. And there will be some bumps, and there will be some times when you think we are not trying hard enough, which was actually what this woman said at dinner last night, that the servers were just hanging out. And I thought, there's half of them, half as many as normal. They're working twice as hard. And I want you to know that's what our staff team is doing, from our high school kid servers all the way up to your executive director. They're working twice as hard to do everything they can to make things as normal as possible. It's going to take a little while longer. And I say this in the memo, but one of our board members told me that she was going on a vacation, and she read this article that said, from Cape Cod, that said the most important thing to pack when you're coming to the Cape this year is patience. And that's what I wish for all of us. I know mine gets a little frayed from time to time, but we need to hang in there together. And I know we can. It's going to take a while. We're not through COVID. We're not through all the challenges that will come even when we are through COVID, but we will get there together. So hang in there.